Urinary tract infection. Urinary tract infection is the infection of the urinary tract. What forms the urinary tract? First one, it starts with kidney. Kidney is a place where the urine is formed. And the urine is carried via a tube called ureters from kidneys to the urinary bladder. Urinary bladder is nothing but a muscular bag that stores the urine and it is excreted outside via the short tube called urethra. So kidney, ureter, bladder and urethra forms the urinary tract. Infection anywhere in these organs, we will call it as urinary tract infection. It can be divided into lower or upper. Lower in the sense urethra and bladder, and upper on the ureter and kidneys are the upper urinary tract. Common encounter lower urinary tract infections. In general, urinary tract infection is common in women rather than men because of the short urethra. In pregnancy, the incidence of urinary tract infections is because of many factors, because of the immunological, physiological, biochemical and hormonal changes that occurs during pregnancy that causes the immunosuppression of the ureters, decreased bladder capacity and the reflux of urine from bladder to the ureter, and during labor because of repeated catheterization, and after delivery because of the pain there will be bladder insensitivity. That leads to increased chances for urinary tract infection, especially in pregnancy. Why should we treat the urinary tract infection? Because urinary tract infection we treat mainly the lower urinary tract infection first irukum. Adu nama treat pannama vittomna it will lead to upper urinary tract infection. We will call it as pyelonephritis. That has its own maternal and fetal morbidity and even mortality. Even stillbirths kuda acute pyelonephritis varum. So அந்த மாதிரி conditions நம்ம prevent பண்றதுக்கு மெயினா we should treat the urinary infection at the earliest ன்னு பார்த்தீங்கன்னா pregnancy asymptomatic bacteriurians சொல்லுவோம். அதாவது பேஷண்ட்ஸ்க்கு எந்தவித சிம்டம்ஸும் இருக்காது. But when we do the urine test, they will be having some pus or bacteria in their urine. அந்த மாதிரி கண்டிஷன் it should be treated. ஏன்னா அதை ட்ரீட் பண்ணலனாலும் 25% they will go into the frank urinary tract infection. அதில் 50% பார்த்தீங்கன்னா acute pyelonephritis போயிடுவாங்க. So during every visit we should do a urine analysis to make sure that there is no asymptomatic bacteria or frank infection. And we should treat them at the earliest to prevent the complications.